Okay, welcome all. I want to say good morning to all of you and to indicate that we are the HU Center for Health Economics and at the University of the West Indies. We are very pleased to have you join us this morning for this engagement, the Social Security webinar. The HU Center for Health Economics is a regional institution which is based at the St. Augustine campus of the University of the West Indies in Trinidad. The center discharges its mandate through its technical support, training, and research. Over the years, the HU has deepened and expanded its research agenda through both center commissioned and partner commissioned project-related activities in multiple areas, including sustainable development, health policy, and in terms of health policy, we have tended to focus a lot on HIV/AIDS, NCDs, being non-communicable diseases, health financing, costing of health services, among and others. We have also made some robust contributions in areas related to fiscal policy, poverty, and social safety nets. And for the few of you who may not be familiar with our work, I want to encourage you to visit our website for further information on our work in this region. In that regard, you will get a link to our website in the chat. The discussion on the sustainability of the region's social security systems is definitely not new. Over the years, concerns have continued to grow with regard to the financial sustainability of our social security systems, which have been challenged by economic shocks, demographic changes, and the projected widening of the gap between contribution incomes and benefit payments. Those are just a few of the issues, and most recently, we have the health, economic, and social impacts of COVID-19 being added to those. While it is true that these risks to the region's social security systems have been discussed across different fora at different times, in our assessment, what we need at this time is a dialogue with continuity, a dialogue with purpose that moves us along to action as partners, in recognition that no one system or organization can effectively face and overcome these challenges working in silos. The seeds to this webinar series were sown in the desire to move into action. This webinar is the first in a series entitled Social Security in the Caribbean, Facing Challenges and Building Resilience. As we move forward in this webinar series, we will be in contact with many of you who are present here to draw on your wealth of experience and to invite you to contribute to the discussions as panelists. Thank you. And I now hand you over to our chair, Dr. Stanley Lalter, who is a research associate at the HU Center for Health Economics. Dr. Lalter has many decades of experience in the social arena doing research related to health and social, the socioeconomic conditions under which people live. Dr. Lalter has been a research officer at the HU and now a research associate of the HU for many years. Dr. Lalter.
Thank you very much, Dr. Lafourcade. Colleagues, good morning. Very pleasant good morning to you from the HU Center for Health Economics. My name is Lalter, Stanley Lalter, and my task is fairly simple: to be the moderator for the discussions this morning. In that context, the less you hear from me, the better. We have 4 very experienced presenters, and the sequence will be, we will commence with Mr. Reginald Thomas, followed by Mr. Haynes, and then by Mr. Osborne, and finally, Mr. Pino from the ILO Caribbean office. Just a brief word on each one of our presenters, commencing with Mr. Thomas. Is a social security expert. If Dr. Lafourcade said I had worked for many decades in the Caribbean, probably Mr. Thomas has worked longer than me in social security matters, not just in the Caribbean, but in Latin America as well as globally. And more than that, he's also a major part of the academic program at the Cavell campus in Barbados, where social security matters have been discussed. His topic is going to be focused on regional collaboration in social security. So let me turn you straight over to Mr. Thomas.
Thank you, Chairman Lalta, and let me greet my fellow panelists and all of the folks who are listening and who thought it necessary for us to have this session today. I'm very delighted to be sharing in this way, given all that has been happening as it relates to social security and the essential aspect of well-being and inclusion. Today, I would look at in terms of why is it necessary for there to be any consideration at all given to regional collaboration regarding social security. I'll say a little bit about the examination of the context, what we are speaking about and the why of it, and what is at stake. What are some of the challenges, the risks, the vulnerability, and what are the changing environmental issues that are impacting social security, as we heard a few of them mentioned just now by head of the HEU, Altia. And then the word of social security, I want to use that point to bring up my end. So I want to share with us this morning a quote from an investigation into the structure, governance, and performance of the social security organizations in the Caribbean. That was the doctoral reference from Dr. Valda E. Henry. And this quote, in its epigraph, quoted the ILO. And then she added a second component to the quote. And the quote said thus: "There is no lasting peace without social justice. There's no social justice without social security. There is no social security without sound financing." And that was the ILO quote of November 26, 1998. And Dr. Henry added, "There is no sound financing without prudent investment. There is no prudent investment without good governance. There is no good governance without men and women of integrity." What we're speaking about today is that to bring to context and to put it back on the agenda, that social security is a safeguard. It is a safety net. It brings and supports well-being and inclusion. And the further significance of social security can be seen because it impacts poverty, family benefits, employment, workplace injuries, disabilities, health, and wellness. Even much more significant is the fact that social security has been deemed a fundamental human right. And it shows the details that social security should have in its operational dynamics so that this fundamental human right can be observed. When we're talking about social security, then we must make sure that we have an examination of the risks, the gaps, the traps, and assess the level of vulnerability so that we can ensure that this system, this component of life, which is a safeguard, which is a safety net, which ensures well-being and inclusion, which impacts so many aspects of our life, is really safeguarded in the way that it ought to be. So when we talk about regional collaboration of social security within our region, we really want to promote uniformity of action across the region And we really want to do that so that we can address the issue of vulnerability so that sustainability can be more higher on the agenda. The quote that I raised just now from Dr. Valda Henry then brings to mind the fact that the scope, the collaboration, the fact that we have always been speaking about the tripartite entity, which is a critical component within Social Security. But is it as significant as it should be? And do we see the composition of all of the key players operating in a dynamic way, which can enhance the functionality and therefore deal with the issue of sustainability of Social Security? What is happening now? Why we should even be having this conversation about regional collaboration within Social Security in our region? Let's examine labor market, from which we get our labor force. What are the challenges? What are we seeing that is happening with labor force participation rate? What are we seeing that is significant to the composition of the labor market? What are the requisite skill sets? And are there any links between the needed skill sets that should drive the labor force that is akin and linked to labor market and sustainability? Is there a link between requisite skill set, productivity, performance, economic growth, and in the end, vulnerability? When we look at the demographic changes, what are we seeing? What is happening with fertility rates? And I know that Mr. Haynes or Mr. Osborne will look deeper into these issues. What is happening with fertility rate? What are we seeing with aging? What's happening with our population? What is happening with health? How are we aging? Many of our systems are adjusting our retirement ages, given again the significance of labor force participation rate or lack thereof, and lack of the requisite skill set to ensure that we have all of the critical components leading up to this one significant key of sustainability. When we add then the health component to that, the health challenges, all of us are acutely aware of the high levels of NCDs, which are impacting labor force performance and productivity rates across our region. How do we address that? What is happening as it relates to new forms of work and how new forms of work are being engaged? How are they regulated? There are too many gaps and exclusions so that the people who are working now from home or working in new forms of work, how are we going to make sure that these persons understand the importance of a social safety net and of a social security system that has been deemed the fundamental human right, linked to inclusion, linked to wellness, linked to well-being? If therefore we have to look at social security collaboration across the region, we must ask ourselves, how do we change and what changes are needed in the operating environment so that we can have social security systems across the region being and doing what they are supposed to do? In that sense, therefore, I want to ask us this morning a very pointed question. What is our opinion on the role and function of public policy to stimulate, to regulate, to enhance, to structure, and to create the enabling environment which will widen the scope, taking into consideration the new health challenges, new forms of work, the demographic issues, and what we're seeing happening in our labor market with the labor force, with the skill set and everything that is needed. Where are we going? When we ask that question, we must look back to see, Have there been any examples of good regional collaboration within social security system in our region? And what success stories do we have? I want to say that when I joined Social Security, one activity that I looked forward to every single year was the heads of Social Security meeting. We will go from country to country, and we will then celebrate anniversaries, and we will then present plaques to our directors, and therefore we will talk about best practices, we look at administrative challenges, and we will report on the Social Security Reciprocal Agreement and what is happening and what is changing. In those meetings, we were able to then structure a format for enhancing and keeping up to date with what changes are required to allow for the Social Security Reciprocal Agreement to be a key component of the single market and the economy in our region. That worked well. And had it not been for COVID, I'm sure Mr. Haynes and some of my colleagues would have invited me to Jamaica last July. So that again, we can continue the conversation and to strengthen the administrative framework across member countries as it relates particularly to the Social Security Reciprocal Agreement. So we had the single market and the economy depending on Social Security to see what is happening. If public policy regulates and stipulates that there should be free movement across CARICOM, what are all of the underpinnings that should support the free movement protocol across the region? The key component of the Social Security Reciprocal Agreement, based on free movement, totalization, and portability. And I can work in St. Vincent and the Grenadines, go to Trinidad and work, go to Barbados and work. And because of the agreement and the single market and the free movement protocol, I can have my benefits when I retire in a competent state, using the Social Security as a competent authority to tell me what my entitlement would be. We had a very famous quote, move and don't lose. So when I move, even the single market requirement, if I move across member countries, it's as if I would have been in the same single space, having no difference in treatment as it relates to my Social Security provisions. That worked well, and that is a very good example. Having been in Mexico, I had several opportunities to be in Latin America, and when we spoke about the Social Security Reciprocal Agreement, I had 3 opportunities to talk about the Social Security Reciprocal Agreement. And everywhere I went in Latin America, this was something that was being looked at to enhance Social Security within that region. Is there time now for us to advance and do more with the Social Security Reciprocal Agreement? Should there be deeper actions taken given the health challenges and all of the issues that are confronting us at a time like this? So the need for collaboration, therefore, must be looked at in a way that tells us that this significant component of our society, this significant component of our lives must be enhanced in several ways. Let me give a few examples that I've been thinking of. I've had several conversations with CAFA, both the former director and the new director, as it relates to a disability assessment framework across our region so that we can promote integration, retooling, and reskilling of persons with disability, given the challenges that we're having in the labor market and the labor force. I want to give us one quick example of how significant that is. Before I left office in 2016, and because the needs within his household was still dominant and still present. Hindsight is 2020. I never thought then that Social Security in St. Vincent and the Grenadines should have been the first institution to lead the way for reskilling, reintegration of persons with disability back into the labor force. Is this a space for needed collaboration, given the NCD challenges, given all of the environmental issues that we have? Can we put together and promote equity and universality so that we have a disability assessment framework that goes across the region, that you have a standardized policy that says how persons with disabilities are treated across our region? What are short-term benefits? We spoke earlier on about new forms of work. What are short-term benefits? We know we have the OECS reciprocal short-term benefit arrangements. Where is it? Health and sustainability measures. We've been talking about national health insurance for quite a while. Mr. Haynes will tell you that we've had, and he was leading an investment protocol across the region for pooling of investment reserves. Because when we went to Miami one year and we tried to get an American company to at least give us some opportunity for investing the Social Security Reserve, the level at which they were coming to us at, we could not take that amount of funds out of the Social Security Reserve in St. Vincent and the Grenadines to put with that form. It was just above our head. Is there space for regional collaboration so that we can get the best buck, the best return on our dollar? What of ICT? Is it time for all of the region to cut out the private sector overreach and killing of Social Security with their recurrent cost every year? Can we come together and own a software based on top of the line technology with bank account and giving us all the stuff that we need and support it in such a way that we have issues that will help Social Security with its sustainability?
Excuse me, Mr. Thomas, it's time to wrap up.
So I'm right there now. So what will facilitate this approach? I spoke earlier about public policy. I think we need to relook public policy so that we can have greater integration across the tripartite entities in the region. Public policy to promote, to facilitate collaboration and to enhance functionality within Social Security. Public policy to restructure the way Social Security report to its constituents. Can we imagine if Social Security would meet every year and have a stakeholders meeting and say this is what, and then all of the appointments for the boards are done based on the ownership constituents? How will that look? Can we have approach to financing which will drive responsiveness, reliability, representation, and responsibility? Can we have an approach that will enhance and strengthen the educational initiatives within schools so that Social Security becomes something that is taught, understood, so that the avoidance will be lessened? I think those are some of the provocative things I wanted to bring this morning.
Thank you very much, Mr. Thomas, for getting us off with all of this information and suggestions. I like the part about a common disability assessment framework, about a pooling of investment reserves, and of course, the deepening of the CARICOM reciprocal agreement, which has already worked fairly well in the past. Our second presenter is Mr. Stuart Haynes. Mr. Haynes is the current Director of National Insurance Services in St. Vincent and the Grenadines. He also holds directorship in a few other organizations, both within St. Vincent and the Grenadines and in the wider OECS countries. Mr. Haynes brings a wealth of knowledge and experience to the table, and therefore let's get from Mr. Haynes some information, some key aspects of some of the main challenges which have been encountered as a result of COVID as a frontline administrator of social security services, some of his responses, the lessons we can take forward. Mr. Haynes, over to you.
All right, thank you, Dr. Lato, for that introduction. And good morning to my fellow panelists and the distinguished virtual audience. It is a profound privilege for me to be part of this conversation about this indispensable tool for socioeconomic stability. I also want to use this opportunity to congratulate the St. Christopher Social Security Board for celebrating its 43rd anniversary on the 1st of February, and also congratulations to the Dominica Social Security for celebrating its 45th anniversary on the same day, the 1st of February. This morning, I will speak to the challenges facing the regional social security, highlight COVID-19 and lessons learned. Our regional social security system, it's a safety net, a promise to provide income protection to individual and household against life cycle risk. And we have broadened that mandate to support people, communities, and societies through sustained investment in empowering our people in employment and in health. In doing so much to so many, we are faced with a myriad of risk. Mr. Thomas highlighted the environmental trend. They are uneven across the different social security system, and the exogenous one are the low and slow economic growth because our small open resource challenge economy. There's above average unemployment, there's growing informality, low productivity, and low to medium skill set within our labor market. The returns on investments are low relative to the risk, and simply because our financial markets are in its nascent stage, and also it's dominated by non-investment grade instrument. We have existence of social conditions that create additional challenges for social security, like poverty and income inequality. The high dependency ratio occasioned by population aging, people are getting older, and at the same time, fertility is declining. And that is exacerbated by the emigration among the working population. On the technological front, there are low and costly technological adoption because our technological infrastructure and network are still developing in the region. There's a new risk and shock we have to manage. COVID-19 that caused disproportionate impact on lives and livelihoods within the region. And it was more acute to our system because of the pre-existing structural challenges that I mentioned before. And the exogenous challenges now create funding pressure, or we say funding imbalance for social security. Most of the regional social security system are at a place where the contribution income, so the contribution base is narrow because of the low economic growth and also high unemployment. They use contribution income and a proportion of investment income to cover benefit expenditure. So therefore, the contributors are no longer contributing towards building the reserve because the benefit expenditure is increasing exponentially owing to the whole maturing of the plan and population aging. There are some other systems that are in worse condition where the contribution income plus investment income plus a proportion of the assets are used to cover the benefit expenditure and also administrative expenses. So the reserves actually are being depleted. So there are different stages in which the system throughout the region. Be mindful that it was a deliberate sort of a financing mechanism to use a partially funded approach. So this will happen as the scheme mature. Endogenous challenges we also face, and they are uneven across the countries. Their coverage is low in some cases, some are stagnant and declining coverage for the self-employed and informal sector workers. Their compliance challenges, disconcerting levels of fraud, errors, and evasion through the labor market. Their capabilities, challenges, skills gap in fields like investment, risk management, actuarial management. And there are also mindset issues relating to embracing changes and being more process-centric than customer-centric. The cost in which Social Security run its business are on the elevated side due to suboptimal use of technology. Their corporate governance needs strengthening, their inadequate risk management in some cases, their lack of business continuity plan, and their developing as it relates to crisis management plan. The communication with our constituents. Most youths 40 and younger know of Social Security rather than about Social Security. So we have work to do in that regard. And with regards to coordination, there's some room for improvement in functional cooperation among regional systems. So Social Security systems were responding to these many-sided challenges pre-COVID and now during COVID. Social Security systems in the region focused on enhancing sustainability. What are some of the measures? Some systems implemented parametric reforms, including increases in pensionable age and contribution rates. St. Vincent, Dominica. Some system de-risking of the investment portfolio through diversification among issuers, sectors, asset class, geographic location. For instance, Grenada. Social Security systems have been building administrative capacity through upskilling and digitization of services. I think over 6 Social Security systems at this present moment are exploring options to enhance their management system. They've been strengthening governance through board education, policy development, and business continuity plan. We also broaden our mandate to ensure economic sustainability. So the system have been investing in employment creation and economic growth projects, hotels, airports, etc. We're providing liquidity support to the financial sector. Some system repatriated funds during the crisis to infuse liquidity in the local financial system because bank adopted measures to support the regional customers. The paying of the contributory benefits in time and in full also contribute to economic activities. Systems have been focusing also on poverty alleviation. We've been paying non-contributory assistance pensioners that contribute to inclusive economic growth. During the crisis, we implemented timely, targeted, transparent, and temporary unemployment benefits to safeguard livelihoods. And we continuously adopt initiatives to broaden coverage to self-employed and informal sector workers. We also have been doing work on the health sector strengthening. There have been monetary contributions throughout the region to assist with the financing of capital projects in health sector. Antigua, for instance. There's sustained investment in health sector to improve access and quality. I could mention SYNCITS there on an annual basis. There have been technical, administrative, and financial support to national health insurance from a Social Security standpoint. For instance, the BVI, Anguilla, Belize. We also have been empowering our people. We invest in education and skills training program to improve the national skill set of our labor force. There's also investment in affordable housing project and the issuing of reasonable price mortgages, St. Lucia, Trinidad, Grenada. Strategic linkages. We strengthening functional cooperation among regional Social Security systems, which involve information sharing. St. Vincent, Grenada, and St. Kitts jointly signed an agreement with the World Bank to enhance the investment management function and framework. And we are anticipating that the other 5 countries will join us soon. I know St. Lucia, Anguilla, Antigua, and so forth are currently doing the diagnostic study with the view of joining the team. We're building a relationship with ISA, ILO, the World Bank, ECCB to build institutional capacity in the administration of Social Security services. COVID-19 has magnified some vulnerabilities within the Social Security system, and they vary across country. For instance, we have seen dated legislative framework that requires modernization with socioeconomic development, including the rapid use of technology. We saw inefficient Social Security delivery infrastructure. There are low digital penetration rates in operation. Predominantly, there are brick and mortar service delivery channels, which we prove is costly, inconvenient, and inflexible. There were low coverage to flexible workers, acute impact on the vulnerable persons, widen income inequality, and increase the incidence of poverty. And hence, we're working towards broadening coverage to the vulnerables. There were no automatic stabilizers in social protection system for unemployment risk outside Barbados and the Bahamas. So we had to make direct interventions by policymakers. And Social Security in that regard serve as first responders on the socioeconomic fronts. In the Eastern Caribbean, over 36,000 persons benefited from the unemployment benefit to some $150-something million or thereabout. And we risk social exclusion of the poor and the indigents. There are also gaps in regards to regional cooperation, and there need to be improvement in terms of coordination between different agencies, Social Security, social welfare, to allow a more quicker and efficient response. How will Social Security systems now build resilience or shape the administrative capacity? We'll focus on funding policy and framework. We develop a funding policy which will serve as a roadmap for future funding of Social Security benefit. This will have to involve extensive stakeholders engagement. Serve also as a basis for future pension reform, including automatic triggers designed within the law to avoid political interference and promote transparency and predictability. And I know this will widen to include national pension reform, because currently in some countries, the civil service pension plan and the Social Security system are not synchronized or not harmonized. They run independently. They run parallel. For instance, in St. Vincent, our replacement rate in Social Security is 60%. The government civil service pension plan, theoretical 67%. When you add that is 127%. So that's a very generous public pension plan. So issues like that would have to be addressed. There would be consideration, there are talks in St. Lucia, in Dominica, in Grenada with regards to the introduction of unemployment insurance benefit, at least the feasibility. When we look at designing, we have to make sure we avoid the K-shaped recovery for inclusive growth and leaving no one behind. The K-shaped recovery meaning those persons that are disproportionately affected. If on the recovery that they will continue to be excluded, and those who haven't been impacted continue to benefit on the recovery, then that's widening the income equality and creating severe pressure for the vulnerables. The focus also will be on investment management framework, building investment governance, including structure, the policies and the accountabilities, aligning investment policies with funding policies to improve the risk return profile of the investment portfolios. Because very few countries in the regions have an established funding policy. We also will be strengthening investment functions, which would include de-risking of the investment portfolio through diversification, and also where possible, utilization of external asset manager for risk management standpoint. There'll be focus also on institutional capacity building that encompasses skill upgrading and procedural improvement. We also will be looking at strengthening administrative capacity, speed up COVID-19 natural causes to speed up digital transformation to improve service quality and cost savings. We have to scale up the conversion of services from inline to online. And for instance, Anguilla, Grenada had very good experience in terms of their agility and the adaptability to COVID-19 and have moved some of their service from over the counter to online, and those are commendable. And other countries are also following in that direction. We also need to accelerate coverage expansion, laser focus on the flexible employment, deepening upskilling of staff in key areas, and also we have to promote the welfare and the well-being of our employees. Without them, we won't be able to deliver and touch lives and livelihood. We have to strengthen management framework
Mr. Haynes,
yes.
Can you be wrapping up?
Right, yes, and business continuity. I spoke about the legislative framework. There's some amendment need to be done to make it more flexible. I think clearly the COVID-19 crisis gives us an opportunity to basically see the fundamental importance of social security to the social and economic stability of our regional economies. So stay safe, stay well, and thank you.
Okay, well, thank you very much, Mr. Haynes, for putting a wealth of information, perspectives from a frontline. And more than from a frontline, I think that your forward-thinking suggestions over there are very well taken and will certainly provide a lot of room for discussion and debate. Our third presenter is Mr. Derek Osborne, again, someone with decades of knowledge and experience working in social security matters in the Caribbean. So he's currently a senior partner at the business consulting firm, Morneau Shepell Limited. He also has his own actuarial company, and he was a past president of the Caribbean Association of Actuaries. Mr. Osborne is also an author, having done a lot of work looking at social security in the Caribbean and published something on this in 2004, 2005. So, Mr. Osborne, looking at financing social security risk in the Caribbean.
Thank you, Dr. Lalter, and happy Thursday to everyone on the panel and on the call. It's really good to be with you this morning and to share with you about financing and sustainability and risk. I will share my screen so that you can see a few things. And, as the previous panelists said, we're going through some challenging times. And at the end of the day, we always talk about our systems making promises to our people. And so I want to start off talking about promises. And at the end of the day, that's pretty much what Social Security does. And in the Caribbean, we see promises from different perspectives. A lot of us who are Christian or are faith believers always put promises in God. When it comes to humans, we tend to be a little bit more concerned about whether the promises that are made to us by those friends and those family members are going to be fulfilled. And a couple of quotes here that we're probably very familiar with in terms of whether promises will be broken, whether they give us comfort and so on. But I came across the other day a really good quote about promises that I'd never seen before, that I really thought was appropriate to the promises that we make as Social Security systems. And I'll read it slowly. The promise given was a necessity of the past. The word broken is a necessity of the present. And I think this is really, really true in the work that we do as senior people in Social Security systems, in terms of identifying changes in society, changes in needs, and along the way, adjusting what we offer to ensure that what we offer is consistent with the needs of society at a given point in time. And so I don't think in our world there's anything wrong with changing the rules in the middle of the game and changing the promise that we made 30, 40 years ago. Because at the end of the day, it's possible to give a different promise that makes society better, that makes the individuals who fit in that society better off, because we provided them with something that's relevant today instead of what might have been relevant 20, 30 years ago. For those of you who have seen me speak before and heard me talk about governance especially, this is one slide I would always use for the last 15, 16 years. And I think it's still true today, that there are 4 ingredients that are essentially required for a strong, relevant social security system. I think number 1 is easy for all of us to understand: a growing economy that's healthy. If people are working and the numbers of workers are growing, incomes are growing, then we're going to have a strong foundation for good financial management, good finances, and hopefully a large fund invested well, good returns that can pay benefits in the future. We also need good design. As I mentioned earlier, our systems, have to go through dynamic changes to make sure that they fit the needs of the country today. And so design is very critical. Admin systems. We heard Stuart mention a while ago about the challenges with COVID and the need for reaching people where they are. We also want to have effective and efficient admin systems. But I think most importantly, we don't control number 1, which is the economy. We can control good design. We can control admin systems by our behavior and the way we lead as social security leaders across the region in terms of honest and responsible government. And this is my way of saying good governance. But I really believe it captures more than just the simple phrase of good governance, because, and I think the quote that Reginald gave earlier from Dr. Valda Henry many years ago about good governance and integrity is really critical to ensuring that we make strides in implementing changes that are going to adjust the way we do things to meet the needs of the people who we're trying to serve today. And so what I've done today, and I've tried to reduce from 4 ingredients to 2 ingredients, because good design and effective and efficient admin systems really also fall under good governance. If we have responsible leaders, they're going to make sure that the design of our systems keep being looked at, and they also are adjusted from time to time. And similarly for admin systems, right? That they will be looked at, and as technology becomes available, it'll be enhanced to provide great service to our employers and employees. In terms of good design, I've tried to boil down what I believe good design comes down to into two single pictures, right? As the heading says, it's not a one-time activity. Good design really is an ongoing activity. But on the left-hand side, we see conflicting targets of adequacy and sustainability. When it comes to pensions and money, all of us want the most possible, right? We want it early, we want it forever, and we want it to be large. But on the other hand, we have to pay for that benefit. And therefore, many of us want to pay 10% or maximum 12% for the benefits that we offer. And as we see across the region now, 10% and 12% won't cut it. We have systems already having 18% and 14%, soon to be 15%. And so we're getting to a point where that rate may become so high that folks may start turning away and looking for alternative ways to finance their income in the old age. On the right-hand side, these few boxes here, I try to demonstrate the mix of benefit offerings that we can provide. And the idea here is that there's no one specific way of doing things, and there's no one specific mixture of allocations between options of doing things. So if you look at income support programs, should most be public across the whole region, across the whole island, or where's the room for private sector? if we look at the benefits offered, we have short-term benefits, pensions, and of course we have to include healthcare. We've heard quite a bit of healthcare this morning already. Very, very important topic as our countries age, and with COVID and with NCDs, having access to healthcare early is going to reduce that burden on our government's coffers down the road when it comes to providing good healthcare to our residents. And finally, solidarity, the concept that we all have come to love and appreciate, all of us pool together, and when it's my turn to get or your turn to get, there's enough funds there for you. Or the approach, which is more individual approach, where the rich pay more but get more, and the lower income people pay less and get less. What is the balance between those two things, or these three different sectors, to make sure that we have a system that provides adequate, equitable, and affordable benefits for our populations? And even though we're going to do this probably every 3 or 4 years, every 10 years for a major reform, at the end of the day, I think most important, not really Social Security related, but to all aspects of life, is that choices have consequences. And if we look at, for example, St. Kitts Nevis Fund today, a very small country relative to others in the region, but they have a large fund. The main reason, they made two big choices at the very beginning. They kept their contribution rate at 10%, and they also increased the age to 62 from day one. So they now have a very big fund. In Barbados, they did pension reform back in 2005, and they raised their rate from 13% to 18%, right? So they now have accumulated large amount of savings that they can call upon in times like this when they have to pay large amounts for unemployment, right? So by acting early and by acting wisely enables us to have those resources and the wherewithal to provide additional benefits or whatever we promised along the way. And in this long-term business, like in every other thing that we live by, if we cannot guarantee the outcome, then we have to plan and manage properly for whatever risks there are possible to put a spoke in whatever we're trying to achieve. And so we've come up with this chart, that I think hopefully puts into one single image 4 policies, 3 questions that we believe are critical to good governance, to leaders and boards and ministers being responsible and honest in what they do and how they serve their residents. The 4 policies we've heard about funding today from Stuart a while ago. We also believe that it should be a benefits policy. For each benefit, why do we offer the benefit? What are we trying to achieve by having this benefit in place? What are we trying to avoid at the same time by having this benefit in place? Whether it be poverty alleviation, ensuring that they're made whole when they have a baby or when they get sick. So each benefit, we believe, should have a one-page document that outlines why we're doing this, what the rules are, what the rules should be, how long it's paid for, and so on. And every now and again, we look at that to ensure that whatever the rules are still relevant to today. And the third question is, when those 2 objectives are in conflict, what overrides? So we want to have a big benefit, but we don't want to pay more than 10%. Those 2 may be in conflict. What then is the driving force to decide where we settle on the benefit generosity and the contribution rate that we're going to accept? Along with those 2 policies, we think we also need a risk policy. Things can go awry. Not everything will work out as we thought it might. And therefore, we should have an established document that highlights what could possibly go wrong and what we can do to make it, if it does go wrong, make that burden smaller on our contributors and eventually on our pensioners. And the one document that all of you already have is an investment policy. We amass large amounts of money, we're saving it for a rainy day, and so there are policies that guide, where we can invest, what rates of return we expect, and so forth. But at the end of the day, execution matters. So we can have these 4 policies, we can have these 3 questions, but we have to find a way to deliver when we've made those decisions and find a way to ensure that we execute and put in place those amendments that are going to make sure that we sustain our funds for the future. And having said all of that, I've tried to summarize all of the risks that I think we face as institutions that are offering short-term benefits, pensions, employment injury benefits into two. At the end of the day, I really believe that there are only two ultimate risks that the entity faces. And number one is not having enough cash to make promised benefits. That is the worst case scenario when you make a promise to a 25-year-old that when they turn 65, we're going to be there for you to give you a pension for the rest of your life. And that that risk can become real when the cash flow of your organization is negative. That means that your contributions plus investment income is less than your payout. And the reason we have reserves is to one day call upon them. There's nothing really wrong with being in a stage where you're calling upon your reserves. That's what they're there for. But we have to manage that money well to ensure that there's enough cash on hand to pay benefits as they become due. The worst case scenario, of course, is assets being depleted and you have no cash to pay benefits. In which case, then we either have to raise the contribution rate or cut benefits. So I'm moving from left to right.
Excuse me, Mr. Osborne.
Yes, Stanley.
Bring up now.
Okay, you're up into the last slide. So the reasons we can have these risks become real is because we can fail to increase the contribution rate, poor compliance, poor investment choices, generous benefits, and weak boards management and governance, right? On the right-hand side, as you can see, and hopefully this will be shared with you afterwards, we have strategies that can mitigate against these risks. But the second big risk is not providing adequate coverage when it is needed. And we saw that through COVID in two instances. We saw many self-employed people not have coverage and therefore government stepping in to give them support. And we have all but Barbados and the Bahamas had a benefit for unemployment. And therefore Social Security schemes stepped in to provide income to people who lost their jobs. And so these are the ways that we can ultimately, I think these are the risks that we ultimately have to face and find ways to prevent them. And my last slide, Dr. Lalta, is some final thoughts on, at the end of the day, whatever we plan for, whatever we do, we should be outcome focused, right? Make sure we have objectives that are stated, we know what we want to achieve, and we plan for situations of what if. What if COVID does not stop in 6 months? What if the economy doesn't turn around for another 5 years? What if investments go down to 2% per year, right? And as people, we tend to be optimistic that yes, the economy will come back, COVID will go away, but that may not happen. And we therefore have to plan for realistic events. As mentioned by Mr. Haynes a while ago in terms of holistic approach to pensions, we also have to look at the private sector. Is there a role for more pensions in the private sector to lower the generosity of our public sector pensions at NIS? And finally, to tell our publics the truth and to tell them the truth early. Like, when we come to them for reforms, they're going to want to know why and what have you done with my money. So sharing the reports of the actuary and sharing the reports of the financial statements are very, very critical to get buy-in from the public. Thank you very much.
All right, thank you very much, Mr. Osborne. In a way, you stepped outside of your actuarial experience framework to get into some of the bigger matters pertaining to governance, sustainability, keeping promises, and how do you actually do that and telling the truth. Thank you again for putting all of this into the discussion. To the participants, can I make a suggestion here that please, for your comments, for your questions, can you use the chat box? We will look at the questions and comments in the chat box first and during the discussion session. And if there's some time left, then we will go to an open floor. But please make use of the chat box for your suggestions, questions, some of which we can handle during the course of this webinar, some of which we'll have to respond later on. Our fourth presenter is going to be Mr. Ariel Pino. Mr. Pino has also many decades of experience in Social Security, having started in Argentina, moving to Latin America, Central America countries, and then from there to ILO office, also having done work in West Africa. And now he is in the Caribbean as the specialist in social protection, occupational safety, and health matters. He's also going to be continuing the discussion on Social Security in the Caribbean. I have to indicate that once we've completed all the presentations and the discussion, Professor Carl Theodore of the University of the West Indies will be doing his summary analysis, his summary evaluation, looking at the way forward and how we can try to ensure that we meet some of these prescriptions which have been suggested by the panelists so far. So over to you, Mr. Pino.
Thank you very much, Dr. Lalta. Good day, everyone. Thank you very much for inviting the ILO to this important webinar. I just wanted to start by a reminder about the overall objective of social protection, which is to achieve universal coverage and building complete and comprehensive social protection system, which means complete, that everyone is covered, and coherent in the way that we use all different social protection mechanisms we have, basically non-contributory and contributory, to achieve universal social protection in a progressive way. So at the end, when you see the human right added by some positive outcomes that you can for social protection, you immediately realize that it's more than just compensating for some risks and contingencies. So it's an empowerment of people, it's investment in people, it's a social necessity, it's an economical necessity, it's a political necessity. Therefore, in my last 5 years in the Caribbean, I see that social protection is reduced to the poor and vulnerable, and it's something that COVID-19 has shown, is actually that we all need social protection in different kinds and different levels, obviously. Despite this challenge, which is recognized by the Sustainable Development Goals, we see that worldwide level, there are big gaps in terms of coverage, and only 45% of the entire population is covered at least with one branch of Social Security, as is said by SDG Target 131. But if you extend that to comprehensive coverage according to Convention 102 with the 9 branches, so we only see that 29%, 30% of people are covered. Of course, we have higher numbers when we talk about health and old age. But for example, when we look into the person with disabilities, or we look at the unemployment protection, we see that figures are extremely low. For Latin America, there was an impressive progress of coverage since 2005, and this is basically for excuse me, for the improvement of non-contributory benefits, and also for the reduction of the informal economy formalization process that Latin America engaged. But still, there are some 60% of vulnerable persons that are not covered by non-contributory schemes. And when you look at the social protection expenditure, it's about 10%, with huge discrepancies among Latin American and the Caribbean countries. I just wanted to now move into the effects that and the challenges that the COVID-19 has brought to the labor market, because as it was rightly explained before, labor market is the key input for Social Security and also social protection, because we need to finance non-contributory schemes, and this comes from taxes. Therefore, if we don't have businesses and we don't have workers that are paying taxes, therefore we don't have funds to finance non-contributory schemes, and we need to increase the debt of the country to provide welfare. So we had our research department at the ILO has developed a nowcasting model, which based on real data, and has estimated that for 2020, 8.8% of working hours were lost, which this is equivalent to 255 million of full-time employment. And this is divided in employment lost or in reduction of the working hours, 50-50. But what is key to see here is that when the employment relationship was lost, the majority of these people shift to inactivity. Therefore, they are not searching for a job. They are not they are not considered as unemployed. So only 33 million are in that situation. And this has brought a heavy toll on the global GDP, which is about 4.4% in 2019. The Americas in these figures is leading the board, and this is not strange because of we know how the pandemic is affecting the region, particularly in Latin America. But when we look at the Caribbean, we see that this figure for equivalent full-time jobs is about 2 million, and this includes, of course, Spanish-speaking, English-speaking, and Dutch-speaking Caribbean. What we have also seen is that these job losses are more importantly in the sectors of accommodation and food and services, arts and culture, retail, and construction. And on the other hand, we have positive effects on employment coming from the information and communication sectors and also financials and insurance activity. There was a disproportionate impact on workers, and we see that young workers, women, the self-employed and low and medium skilled workers were the most affected in terms of employment lost or in reduction of the working hours, which is also predicting at the same time that the recovery will be uneven when we look at the labor market. We also have seen is that although there were a number of income support programs that were actually quickly implemented and temporarily implemented to support livelihoods, in rarely cases this was tied to reskilling people and therefore creating some more employability and ensuring, or at least giving a better perspective in the employment trajectory during the recovery. We have collected some figures also from some social security contributions last year to see how contributors how contributors have changed, and we see that in some cases there were heavy losses in contributors. It's difficult to say if this is because the break of the employment relationship or it's just arrears because employers are not making contributions, are not making declarations. But the worst movement was, as it was shown here, the worst movement is certainly in Q2 of 2020, and then some sort of recovery is seen thereafter. When we look at the responses, actually, COVID-19 on the social protection, so there was, and this is not just Caribbean, but also at the regional and global level. So there was big effort put on preserving the employment relationship, because we know how difficult is when the employment relationship is broken to get into a new employment relationship, and also in terms of times and in terms of costs and impact that they have in the households of those who lost unemployment. And this was basically done through wage subsidies, tax concessions, access to credit, and other monetary policy programs. There were income support to the unemployed and the poor and vulnerable. The unemployed, I think they were the new vulnerable groups, actually, because they were affected the first when the pandemic arose, compared with the poor and vulnerable, because the disposable income of the poor and the vulnerable at the beginning was not affected. I mean, they really had a problem, probably an accessibility problem to services and cash transfers, but in terms of disposable income, they were in the same situation before COVID-19. And I saw that in many aspects, in many countries, so they first addressed the poor and vulnerable instead of addressing the unemployed. So a missed opportunity was an opportunity was missed there, just to what I said before, to preserve the employment relationship from the beginning. So probably we could have avoided some job losses if some countries were had done that in the other way around. Also, in-kind support in terms of food assistance, basically, and also access to services, social services. We saw that there was a spark in domestic violence, gender-based violence cases. So measures were also implemented. There were adaptation of requirements in Social Security, either from the benefit side or from the contribution side. And as it was mentioned by Mr. Hines, the governance of the Social Security institutions and other social protection programs has had to adapt and reach those vulnerable groups, particularly in a context of lockdown and restriction mobility, and also where banking of these people was not widely disseminated. So reaching them was difficult, and also transferring cash was also difficult. And as I said before, in a few countries, particularly in Latin America and the Caribbean, we have seen linkages between income support and skills development, or any other type of active labor market policies to actually promote employability. And yes, as Mr. Hines said, also Social Security, we consider that they were the first respondents during the pandemic. So these are just some figures of the protection of the unemployed in the Caribbean. And as you can see, almost all jurisdictions in the Caribbean who don't have unemployment insurance, like the Bahamas and Barbados, have implemented some sort of unemployment protection mechanism, which is non-contributory. In some cases, the requirements are that they are affiliated to the Social Security. In other cases, not. And in some cases are financed through reserves, and in other cases are financed through public revenue from the government. In terms of the response proposed by the ILO, so it's basically addressing this recovery to reach an inclusive recovery where everyone can benefit from the recovery, and it should be focused on 4 pillars. The 4 pillars that you have there on the screen, particularly interest in social protection and Social Security institutions, are pillars 3 and pillar 2. And as you can see there, some of the proposals that are included there is what has been mentioned by the 3 speakers that spoke before. But I didn't want to leave without saying that the social dialogue, the importance of having social dialogue in designing these, let's say, exit strategies for an inclusive recovery. And what we have seen during the pandemic, or at the beginning of the pandemic, I would say, because we are still in the pandemic, is that measures have been implemented without engaging workers and employers. And a few countries have now started to engage with workers and employers in designing recovery programs. And of course, this includes social protection and Social Security. I just wanted to show you now the importance of having a holistic approach to the unemployment protection, which I think has gathered a lot of attentions of policymakers in the Caribbean, and the cost assessment that some countries have engaged in to implement the unemployment insurance scheme in their country. So the idea of having a holistic approach of unemployment or employment protection schemes, as the modern literature is calling now, is actually to, first of all, work on the employment relationship. So do everything you can through an unemployment protection mechanism to keep the relationship, either providing part-time unemployment benefits or entering in work sharing agreements. And then when the employment relationship is broken, then you have a compensation. But this has to be linked with active labor market policies, which basically are geared to increase the vocational educational training, skills, also related to employment services, job matching, job reskilling, adapting the startup of business, promoting the startup of small business, micro businesses, and something which is not very expanded in the Caribbean and has a great potential to actually create jobs and restore livelihood is public employment programs. So in a few countries, you can find well-developed, well-established, I would say, public employment programs with the deficiencies they have, but at least they are there. And on that side, there is a big potential in other countries to look into these public employment programs, which can make an excellent bridge between non-contributory schemes. Actually, it's a graduation strategy from non-contributory schemes towards contributory schemes, because these people can actually get included in the labor market. So to conclude, these recommendations are actually in a context that we are seeing in the future, in a context, well, we will have more low-paid jobs in the labor market. We also we expect that the forms of employment will be more precarious than before. Non-standard forms of employment will be more predominant than before. And the phenomenon of telework or work from home, or at least not work in the workplace. And so I think these three key issues are bringing particular challenge for social security institutions. And I think in every reform or every activity that they engage, they keep in mind the context in which the social insurance will be operating. So the first recommendations is to undertake feasibility studies to implement the unemployment protection schemes. And we are working with St. Lucia, Dominica, and starting soon with Jamaica and Trinidad and Tobago. I also know, I think Mr. Osborne is working with Grenada on that too. They assess the impact of the COVID-19 on the financial sustainability of social security schemes and include shock scenarios in actuarial reviews. So we are doing that for the feasibility studies we are doing. We are including this shock scenario, and also in the actuarial reviews that we are doing, we will be also looking into that scenarios. There was difficulties in some social security institutions to quickly create data or use the data of the social security statistics and coverage indicators during the pandemic. So there is probably an opportunity there for collaboration among social security institutions to develop some sort of standardized social security statistics and coverage indicators, which will also really help in conducting actuarial reviews. I think social security institutions need also look into the shock responsiveness of their schemes, not only as an institution itself, and business recovery, business continuity plans were mentioned, but also considering the parameters that can be shock responsive, or how they can be adapted in case of shocks. We heard about the extension of coverage to the self-employed, but I will also go beyond that and look into the non-standard forms of employment, including telework, that is quite present now, because this can pose a challenge to the social security institutions, because you can have in your island or in your country a worker which is actually located you don't know where. I think the evidence.
Excuse me, Mr. Pino.
Yes.
Wrap up there.
Yeah. I think the responsible governance that Mr. Osborne talked is great. I think they also should probably try to go the extra mile and consider the administration of non-contributory schemes. Is something that they had to do in a very short period of time with unemployment schemes, and it proved extremely valuable. And when you compare the number of people that they managed to cover in a short period of time compared with the expansion and new non-contributory benefit, it's actually commendable. So I think that can give also much more power to the social security institutions by engaging in non-contributory schemes. I think it's on the interest of social security institutions to invest, as it was said, in health, but also in employment promotion, because at the end, the less people are left behind and not in the labor market, so they had to be covered by social protection. I also see that there is in the Caribbean, there is a lot of money coming from the development assistance to improve social protection programs. And I participate in most of them, and I don't see social security institutions represented there. So I think there is here an effort that social security institutions can make to be part of the of these donors tables or development assistance funds coming that can really help the institution. Just this morning, I was having a discussion with one of them on some funds that can be available through different funds in the recovery of the COVID. And finally, as I said before, the importance of having workers and employers in the decision process and also in the delivery process is key. Thank you, Chairman.
Okay, thank you very much, Mr. Pino. I think that you have put on the table several critical matters. I really like the data set that you have advanced and looking at the 4 pillars which have been recommended by the ILO. Participants, we now have come to the end of the formal presentations. We have a few minutes set aside for our questions and comments. As I indicated, we started with the chat box, and there's quite a flurry of activity on the chat box, and there are 4 specific ones which I want to pull out and to put to some of the panelists. Probably the first one really is to Mr. Thomas, and that is one where someone has asked a question. So we have all these ideas for collaboration, and we've done some studies and we have examples in the past, but how do you move from a CARICOM basis? How do you move from ideas to implementation? What's the gap? What's the trap? How do we move forward to implementation of these? Mr. Thomas?
Thank you, Stanley, and thanks for the question. I believe we didn't get a lot into, but if you notice, all of the presenters speak about the whole issue of public policy and engagement and facilitation. And I think I pointed to some of the issues that we discussed at the Heads of Social Security meeting. And the Heads of Social Security meeting had the mechanism whereby we will name 4 or 2 heads of Social Security to then represent COTED, and then you go on from COTED and you go then to the Council of Ministers, so that we have a direct relation between the Social Security institutions and the recommendations and the changes that we spoke about, which in terms of heightening the level of responsiveness of Social Security to the changing dynamic and to the critical happening within our region, and therefore make it much more representative. So we have that engagement with the policymakers and the politicians. The other thing is, what if we really were to really examine the aspect of treating every contributor as a shareholder? And in that way, when we examine that, to have at the end, once the actuarial report and the accounts are finished, all of the stakeholders, government, employers, trade unions, you come there, you nominate all of your personnel to sit on the Social Security Board. What if this can then be the new form of governance? So it comes and everybody who is there in terms of a contributor see and have a voice in relation to that. What if we were to look at the contribution on a weighted average perspective? Government is the single largest employer across the region, but most private sector entities pay higher salaries than do government. So therefore, when you look at the weighted average of contribution, you're having more contribution coming in from the private sector to the Social Security systems, given that we look at it from that perspective. Can we then see a mechanism going forward whereby the heightened visibility representation of the tripartite entity in governance of Social Security becomes something that we need to heighten and advance? And I think Mr. Osborne spoke about this, Mr. Haynes spoke about it, and then Ariel spoke about it. And I think that's where we need to go to expand the conversation. I always remember when Professor Theodore was talking about AIDS, when AIDS came on the agenda. They had this big meeting in Washington, and not a social security institution from the Caribbean or anywhere in the world was invited. But you're dealing with something that had perceives critical impact on labor force and labor market participation. But Social Security work, no. And so therefore the policy making aspect is always devoid of the connection from the practitioners, from the Social Security persons. And
Thank you.
that would be my response.
Thanks very much, Mr. Thomas. The second question which has come up is one which I really want to put to Mr. Osborne. And that is, having done work throughout the Caribbean countries with Social Security and elsewhere. And it's a point which was raised by both Mr. Thomas and Mr. Pino, and it was certainly referenced by Mr. Haynes. Derek, a standardized Social Security model for the Caribbean. There's still variations, several variations in laws, regulations, procedures, benefits, funding, all of these things. Can we all benefit from a standardized model for the Caribbean?
So I think there's certain things that can be standardized, but certain things cannot be. So for example, the wage ceiling, minimum pensions, those dollar values that are specific to the local economy are difficult to standardize, because what may be good in St. Vincent or Dominica will be too low for Antigua and St. Kitts, okay? And so there are things in terms of benefit rules, and the maximum replacement rates, the accrual rates going forward. I think the average pension, if you use 3 years, 5 years career, as just suggested, those things could be standardized. I mean, we can all go in a room and decide what's best, given our different circumstances. So I think, short answer, some things can be standardized, some things not.
Okay, thanks, Derek, because there's a major set of information that will need to be gathered, as you indicated, for this to work. And I think it was mentioned by Mr. Thomas about uniformity, but is it harmony more than uniformity that we may be looking for if the CSME, the Caribbean Single Market and Economy, and so is going to be making much more progress? I just throw that one out. The third question is really—
One point, Stanley, before I go, is also labor laws are different, right?
Yeah.
So you also want to be consistent with whatever other government laws there are that provide income support to workers and elderly and unemployed and vulnerable, right? So harmonization has to be local, but definitely collaboration regionally would be great.
Yeah, okay, thanks for that addition. Mr. Haynes, there's a key question which came up over here, and I think probably you may be best positioned to speak about this, although it was also mentioned by Mr. Pino. You indicated in your presentation that in many respects, Social Security was one of the first responders in this crisis, paying benefits, and managing benefits for the population and looking at some of the social mitigation measures. What did that do to your resource base? What did that do to your administrative arrangement? Is this something which you think should be built in even more into Social Security rather than leaving it to Department of Social Services or Ministry of Social Services, for example, to manage? How can you be geared towards dealing with these matters more in the future?
All right, yes. So thank you. And it's a very, very important question. So clearly the Social Security systems that did not have that as automatic trigger then had to respond because significant proportion of their contributors were basically moving from being from a worker to basically into poverty. And driven by our principles of solidarity, social cohesion, and also trying to bridge in terms of income equality, we had to respond because the way we were funded naturally is partially funded. So we had to tap into our reserve. It is temporary to kind of provide some protection for these workers. And one of the key lessons learned is that, we provide that temporary support to them. Is there a need for that to be part and parcel of our benefit package? Ariel mentioned that we commenced in terms of the conversation. For instance, we had a meeting with the Social Security heads and ILO to discuss the whole issue of the unemployment insurance benefit Ariel mentioned that few countries started the conversation. So clearly we see that as part of broadening the safety net, the inclusion of an unemployment benefit, but it must be funded because our response will basically non-contributory. And that's why we cap it, and we still, dialogue among each other in terms of when we fashion in the design so that it won't cause material impact in terms of our sustainability. But it did result in terms of paying more benefits. But our people benefited.
Good. Thanks, Mr. Haynes, because I think it has come up not just in the context of COVID-19 and the implications for the society, but also remember, Caribbean is living in a disaster-prone area. And
absolutely.
After climatic disasters, Social Security is drawn into the middle of all of these instances where you have to provide some sort of social protection or mitigation measures. And I think it's also going to come up again more and more as you think about being first responders.
Absolutely, because for the case of Grenada, they did it after a hurricane, and also Anguilla in 2017. So clearly there's a conversation around making it part and parcel of the benefit package.
Okay, great, good, thank you. And a fourth question which came out from the chat box, and we can put this one to Mr. Pino. There's some persons who would really want to get access to your data that you presented, Mr. Pino. So hopefully you will share that with us at the HEU, and we will put it on our website, and we can allow participants to get that. The question really for you comes up from that point which you made about social dialogue. Remember in your 4 pillars that you had indicated, you raised the point about social dialogue, expanding social dialogue. Already there's the tripartite arrangement in most of these social security organizations, government, labor, and business. Are there other parties that you're thinking about that should be part of the social dialogue?
Yes, thank you. Yeah, I have shared the links of the reports that you can find, and I think in the chat we'll also share with everyone. Yes, yeah, of course, although in some institutions in the Caribbean, we still don't have tripartite representation in the board city, not in all of them we have, but it's something that, of course, we promote that they are included. Let me share with you one great experience that exists in Uruguay concerning that. Uruguay is one of the few countries in the world that representatives for the beneficiaries, retired persons, sit on the board, right? And this is a national election, which means that it's mandatory for all the retired persons going to vote for their representative in the Social Security organizations. And you can believe me that this person get more votes than a parliamentary there, right? And they have they have great knowledge, and they have a heavy voice in the Social Security organization. So certainly what we call tripartite plus at the ILO, which means including other people than government employees, workers, which may be representative from the beneficiaries, representatives from the informal economy, the self-employed and other workers in the informal economy, disadvantaged groups. You can include the academia. You can also include faith-based organizations. In a nutshell, civil society can also be part of the tripartite dialogue. So definitely, the more consensus you can reach, I think is the easiest. It's actually to swallow the pillow in terms of pension reform. Pension reform is never good news for anyone, because either one has to pay more or will receive less. So at the end, you need to find the right middle for everyone. And if you don't engage in social dialogue, in transparent discussions, as Mr. Orban said, so it will be difficult then to actually get the reforms that you need to make the pension system sustainable over time.
Good. Thank you. Thank you very much, Mr. Pino. There are a couple of other questions which have come up and several other comments, and these we will share with the panelists, so then you can send in some responses. I want to give some time now. I want to give some time now to Professor Carl Theodore. In a real sense, Professor Theodore has lived through all of this. He's lived through the formative years of social security organizations in the Caribbean. He's seen them grow. He's seen promises made, promises not kept. And now we are at the stage where we are asking hard questions once more about social security organizations. Prof, given the presentations, given your experience, your knowledge in the field from an academic professional and of someone who's actually been through all of this, I'm not too sure if you're a beneficiary yet of social security measures, but Prof, in all of this, what's the way forward in all of this so that we can become better, stronger, more efficient for the population?
Okay, Sandy, thanks, and good day to all. Good morning. I think we are still in the morning. I think it's the way forward is interesting. I think what came out this morning, the first thing that struck me was that we got a reminder of how important Social Security is to us. That came out in all the presentations, very strong. And I think what linked to that, the question then, and is a question, and it was summarized in what Derek said, but I think all the presenters face it. The question is the capacity of these Social Security institutions to really deliver on their promises. And I think the discussion, I thought the discussion was really rich, and the discussion has pointed us, I think. Reggie's reminder that the discussion we started on pooling of investment on a regional basis, that is something, again, we have to put back on the table. That is one of the things we certainly have to put back on the table. Mr. Haynes, he reminded us that a part of the response of the Social Security was the investment in education and in housing. In education especially, that again is something I think that for the future, that is something we have to put on the table, that our Social Security institutions have to focus on that kind of investment. Derek spoke a lot about governance and the importance of governance. Now that is something we could talk about for the whole month, and that is something that is absolutely crucial. How we do what we do, and I think that we have to be, we have always to be in Social Security. We always have to be very, very conscious, because we are impacting people's lives, and therefore what we do matters to what happens to the people, and therefore those choices you make then become very important. Mr. Pino, he reminded us that employment, promotion, and social protection were linked, and that the discussion on unemployment insurance is something that we certainly have to take up. So that is something for the future. So there are a number of issues that came up this morning that tell us about the things that we have to start talking about. And this COVID period, you see, COVID is telling us that things like equity and empathy are crucial to how we respond. But what we have been calling solidarity all these years, that is what it is about. Solidarity is about equity, and it is about empathy. And I think what strikes me is that at this COVID period is a time when our Social Security values, we have to try to make sure that the values we have been holding on to are the values that we try to make sure that our public policy, the public policy that Reggie keeps talking about, that public policy is reflective of a solidarity approach. Now, when I think of the capacity of the Social Security to deliver on the promises, one of the things that strikes me is something that we have spoken about for years, and that is the fact that maybe the time has come, and COVID is probably telling us that now the time has come when the Social Security institutions have to think about whether they're going to continue. Derek spoke about the importance of the economy. The economy has to keep going if the Social Security is to be sustained. But the fact is that the Social Security systems have generally remained passive in respect of economic growth. And we have said, and it has been said before, and I think we have to say it again, that maybe with the resources of the social security systems in the region, the question that we have to put on the table is whether the social security systems cannot begin to look at themselves as they are one of the institutions that would start influencing the rate of economic growth and the level of employment in our countries. You see, if Social Security depends on contribution rates, which depends on the level of employment and the level of incomes, it means that the Social Security should ask itself, is there anything we can do to ensure that the level of employment and the level of incomes keeps rising? Now, and that means that the kind of investments, Derek and Sahin spoke about it, the kind of investments we thinking about and talking about, we now have to start thinking about what are the investments that would help our social security systems to influence those variables that matter to us. And I think that is one of the things that we have to think about. And based on everything I heard this morning, I think if we add that to the list, I think we will have enough on our plate to work out how we go forward. Because the important thing about going forward is going forward in a way where, again, going back to Derek, where our social security systems are really delivering on the promises. What I'm suggesting here is that we have to put ourselves in a better position where we can deliver. And that means we can't remain passive where the economy is concerned. The social security systems have to begin to try to influence what is happening in the economies of our region. I think if we add that to all the discussion we had this morning, I think we have a major task facing us to deliver on those promises that as Social Security we really have been making to people over the years. Okay, I think that's where I want to end. Thank you.
Good, thank you very much, Prof. And I can probably point out that quite apart from the institutional sustainability issues that Social Security has to grapple with, we are all involved directly. All of us will be at some point be in line to receive benefits from Social Security. So I would hope that Social Security survives and thrives, just to ensure that from a selfish point of view, we do have our benefits intact. Can we take that as a promise, Derek Osborne? Colleagues and participants, we really have to close it off over here. There are more webinars which we are planning around this. We haven't exhausted the discussions. We want to move some of these forward even further, and we will inform you of these coming up. The queries and the questions which have come up in the chat box, we will go through these and get the panelists to respond to these and send these to you by your email. There's an audio recording of this session, which is also going to be placed on our website, the HU website, and persons can have access to that. Similarly for the presentations which have been made by the panelists. Let me then thank you, the participants, for being with us for the morning. As I said, stay tuned. There's more coming up later on. Let me thank the panelists who have taken the time off to put their material, their thoughts together and expose themselves. I hope that when you get the rest of the questions from the chat box, that you will not shy away from putting your full responses over there. Let me thank the HU team over here at the office for administering, putting together this webinar, and the marketing department of the University of the West Indies supporting us through all of this. From us over here then, unless Dr. Althea Lafourcade, our formal host, Dr. Lafourcade, unless you have any other closing remarks, this is it from me, Stanley Lalto, as your moderator.
We have quite, we have had a good morning session, a good first installment of this webinar series on Social Security. And all that's left is for me to again reinforce our thanks to all participants, all panelists, all the individuals who helped to mount this event, to put this together. And we'll be reaching out to you as we indicated earlier in the session. We'll be reaching out to you. This is not the end of the discussion by any means. Thank you so very much. Stanley?